Welcome back, everyone, to Health Z Podcast. Have a concerning topic to discuss tonight with my co-host, Luna.
Hi, everyone.
We're diving into the issue of medical errors. It's something that touches all of us, really.
It definitely does.
And for this deep dive, we've gathered some important research to understand the core of the problem. Just how often these errors happen, what kinds of errors they are,
Hmm.
what the healthcare system is doing about it, and maybe most importantly, what practical steps you can take to, well, protect yourself.
Yeah, understanding the landscape here can really empower all of us.
Okay, so let's unpack this. Where do we start?
Well, maybe first, what is a medical error? Generally, we mean a failure to um, establish an accurate and timely explanation of a patient's health problems
Okay.
or failing to communicate that explanation effectively.
Hmm.
It also covers things like delayed diagnoses or even missed ones entirely.
Got it. So it's about getting it right, getting it on time, and making sure people understand.
Exactly. And when you look at the big picture in the U.S., the numbers,
Hmm.
they're pretty significant. Medical errors have actually been cited as a leading cause of death.
Wow. A leading cause. That's really sobering.
It is. It's a serious public health problem.
And I understand the estimates of harm, they kind of vary, right? Which can be a bit confusing.
They do vary. One study we looked at reported around 400,000 hospitalized patients experience some kind of preventable harm each year.
400,000 just in hospitals.
Right. Another estimate suggested maybe over 200,000 deaths annually, again from preventable errors.
Okay, still huge numbers.
But then there's a more recent study. This one's quite striking. It estimates nearly 800,000 Americans might die or become permanently disabled every year because of diagnostic errors.
800,000 from diagnosis mistakes alone.
Yes, and that's across all care settings, not just hospitals. This study even suggests that diagnostic error might be the single largest source of serious harm from medical mistakes.
That's astounding. More than everything else combined, potentially.
Potentially, yes. That's what the research indicates. It really highlights how critical and complex diagnosis is.
But I imagine numbers that high might cause some debate.
Absolutely. There's definitely ongoing discussion about the very high end of these estimates. Some experts worry, that such large figures, while they raise awareness,
Right.
they could maybe undermine public confidence in patient safety research,
Yeah.
or even potentially discourage people from seeking care when they need it.
That's a really important point. It's a tricky balance, isn't it? You need to flag the seriousness, but without causing panic or breaking that trust.
Exactly. It's delicate.
Yeah.
But, even if we debate the absolute highest numbers, the core message is clear. Preventable medical errors are a major problem we need to keep focusing on.
And it's not just the human cost, is it? There's a financial side, too.
Oh, definitely. Adverse events, so harm linked to errors, they're estimated to cost the healthcare system something like $20 billion a year.
20 billion.
And that's not all. If you just look at infections people get in the hospital-acquired infections,
Oh.
those alone are thought to cost somewhere between, say, $35 billion and $45 billion annually.
Wow. So the financial impact is just enormous.
It's massive.
Yeah.
It affects patients, families, obviously, but also the clinicians, the hospitals, the whole community, really.
And what about the doctors and nurses involved? It must take a toll.
It really does. Clinicians can suffer profound psychological effects after being involved in an error, even if they weren't, directly at fault. There's guilt, feelings of inadequacy, fear of lawsuits. It's tough.
Yeah, I can only imagine. Okay, so we've got a sense of the scale, the cost. Let's maybe dig into the specifics. What are the most common types of errors? Where do things tend to go wrong?
Well, surgical errors are certainly a high-risk area. They often carry the greatest potential for really severe patient injury or even death.
Okay, surgery.
Yeah, one source suggested that problems during the operation intraoperative errors are the main issue in about 75% of malpractice cases involving surgeons.
75%. And we hear about those awful never events, right? Wrong site, wrong patient, wrong surgery. How does that even happen?
It seems unbelievable. I know. But it's usually a combination of factors, things like clinicians being rushed or distracted, maybe fatigue playing a role. Miscommunication within the team is a big one. Sometimes inadequate staffing or changes in staff mid-procedure, even organizational things like how specimens are handled or issues with the medical records.
So lots of system-level things, not just one person's mistake.
Often, yes. And then there are what we call cognitive errors, sort of mistakes in judgment or thinking during the surgery itself.
Okay, that's a lot to consider just for surgery. What about outside the operating room? You mentioned that huge number for diagnostic errors earlier.
Yes, diagnostic errors are absolutely critical. The Joint Commission estimates they contribute to the death or injury of maybe 40,000 to 80,000 patients each year.
40 to 80,000,
Yes.
still a huge number.
It is. And interestingly, some research suggests these errors might be more common in primary care settings, especially maybe solo practices.
Really? Why is that?
Well, the thinking is it could be due to higher workload, maybe more time pressure, potentially less immediate access to colleagues for a quick consult compared to, say, a big hospital,
Right, a solo doctor juggling a lot.
potentially.
Mm.
One study estimated something like 12 million diagnostic errors happen annually in the U.S. overall.
12 million.
Yeah, and about a third of those were thought to cause some level of patient injury. We see adverse events from diagnostic errors affecting about 5% of outpatients, but that jumps to around 17% for hospitalized patients.
Why the big jump for inpatients?
Likely because hospitalized patients are often sicker, their conditions are more complex, the intensity of care is higher, which unfortunately just creates more opportunities for things to be missed or misinterpreted.
And are there certain conditions that are more likely to be misdiagnosed?
Yes, the data points to a few areas. The top 5 seem to be malignancies, cancers, complications after surgery, neurological issues, cardiac problems, and urological conditions.
Huh. Why are those specific ones?
Often, it seems to boil down to gaps in knowledge or maybe flaws in the clinical reasoning process for those particular challenging conditions.
Okay. And what contributes to these diagnostic mistakes? Similar factors to surgery.
For similar, yes. Things like clinician fatigue, being distracted, maybe not fully considering all the possible diagnoses, what's called the differential diagnosis.
Right.
Also, failing to follow up properly on test results or not having adequate follow-up with the patient themselves. These can all play a part.
It really sounds like communication keeps coming up as a theme here.
It absolutely does. Communication breakdowns are very frequently cited as a contributing factor in adverse events.
What causes the breakdowns?
It can be a whole range of things.
Yeah.
Disruptive behavior sometimes between staff members, just environmental distractions, differences in culture or professional hierarchy, maybe making someone hesitant to speak up, personality clashes, language barriers between the patient and provider, even socioeconomic things like differences in education or health literacy.
And it's not just talking, right? Written stuff matters, too.
Oh, definitely. Errors in written communication are a big concern. Using non-standard abbreviations that someone else might misread.
Have those weird acronyms doctors use.
Exactly. Or just illegible handwriting. Failing to question an order that seems unclear. Incorrectly labeling lab specimens, for example.
I can see how that could lead to problems fast.
Very fast. And patient handoffs, when care transfers between providers or settings, that's a really vulnerable time if information gets left out or it's inaccurate.
Yeah, passing the baton.
Precisely. And similarly, discharge. If patients don't get clear, understandable instructions when they leave, they're at risk when they get home.
Okay, so we've hit surgical, diagnostic, communication. What else is common?
Medication errors are another really significant category. Big one.
Right. Getting the wrong drug or the wrong dose.
Exactly.
Yeah.
It can happen during prescribing, during dispensing at the pharmacy, when the dose is being calculated, or when it's actually given to the patient.
Yeah.
Lots of steps.
Seems like lots of chances for error.
It does. But the good news here is many medication errors are considered preventable.
Okay. What are common examples?
Things like overriding safety alerts in the computer system without a good reason.
Yeah.
Mix-ups between drugs that have similar-sounding names look alike, sound alike drug.
Oh, yeah, I've heard of that.
Or using medications that are out of date. Simple things sometimes.
Okay. Anything else major?
One more big category. Hospital-acquired infections or HAIs.
Infections people catch in the hospital.
That's right. They're often seen as a kind of system failure in infection control. And it's alarming, maybe as many as 1 in 20 hospitalized patients might get one.
1 in 20, wow.
Yeah. And they lead to more complications, longer stays, higher costs.
What causes them usually?
Often it comes down to basics. Poor hand hygiene among staff is a major factor. Or improper technique when inserting or caring for devices like urinary catheters or central lines.
So basic hygiene and procedures?
Largely, yes. The most common types we see are catheter-associated urinary tract infections, UTIs, surgical site infections, hospital-acquired pneumonia, bloodstream infections linked to central lines, and skin infections related to care.
Okay. That's quite a list of potential pitfalls. It's sobering to think about all the different points where things could go wrong.
It really is.
So, given all this, the big question is, what is actually being done about it? What's the healthcare system doing to try and reduce these errors?
Yeah, that's crucial. And there are many, many strategies being implemented across all these areas. It's a huge focus.
Okay, like what? For surgery?
For surgery, standardized checklists are huge now.
Yeah.
Before, during, after the procedure.
Like a pilot's checklist.
Very similar concept. Also, things like carefully counting sponges and instruments, making absolutely sure nothing gets left behind.
Right.
Using medications to prevent blood clots. Using special sponges marked with radiofrequency tags so they can be detected if they're left inside.
Oh, that's clever.
And the surgical timeout. That's absolutely critical. The whole team pauses right before starting, confirms patient, procedure, site. Everyone has to agree.
That timeout seems so simple, but so essential.
Fundamentally important, yes.
Okay, what about tackling those diagnostic errors? That seemed like a really complex area.
It is complex, so the approach has to be multifaceted. Systems are putting in place safety checks, kind of built into the workflow.
Like automated alerts.
Sometimes, yes. Also, using cognitive aids to help clinicians think things through, diagnostic algorithms, trigger tools in electronic health records that might flag possibilities based on symptoms and results.
Ah, using the data.
Exactly. Checklists again to make sure key things are considered. And then there's addressing knowledge gaps.
How do you do that?
Using decision support tools like apps or computer programs with up-to-date info, simulation-based training, letting doctors practice diagnostic skills safely.
Encouraging more consultation with specialists for tricky cases, and also fostering critical thinking, encouraging doctors to, pause and reflect on complex cases, promoting case discussions, seeking second opinions.
So technology and human factors, improving thinking.
Yes, it has to be both.
And medication errors. You
Yeah.
said many are preventable. Tech must help there too.
Definitely. Computerized provider order entry CPOE is a big one. It makes prescriptions electronic, clearer, less prone to handwriting or abbreviation errors,
Right, no more doctor scrawl.
hopefully. Barcoding systems are also common now. Scanning the patient wristband, scanning the medication, confirms it's the right patient, right drug, right dose, right time.
That seems very effective.
It helps a lot. Also, standardizing units, using weight-based dosing where needed, having pharmacists heavily involved in reviewing orders.
The pharmacist as a safety net, a crucial one, rechecking meds before giving them. Using automated dispensing machines, proper storage, even things like color-coding 5E lines or labeling syringes clearly, capitalizing parts of drug names that look similar to prevent mix-ups. Lots of layers.
Okay. And the hospital infections. Sounds like it comes down to basic hygiene.
That's the cornerstone, yes. Strong hand hygiene campaigns are essential. But also specific protocols.
Like,
Protocols for minimizing how often catheters are used and how long they stay in, making sure they're inserted and cared for using sterile technique.
got it.
Many hospitals have antibiotic stewardship programs, usually run by pharmacy, to make sure antibiotics are used correctly and fight resistance. Regular skin checks by wound care teams, evidence-based care for surgical sites. It's very protocol-driven.
And communication, that thread running through everything, how do you improve that?
Culture is huge. Creating a workplace where people feel safe speaking up, where communication is respectful.
Easier said than done sometimes, I imagine.
It can be.
Yeah.
But institutions are trying. Risk management committees, joint education programs for different professions to understand each other better. Using specific techniques like readback, repeating critical results or orders to confirm, avoiding those dangerous abbreviations. Always using at least 2 ways to identify a patient before doing anything.
Name and date of birth, usually.
Prominently, yes. Having clear protocols, actually listening to patient questions. Encouraging patients and families to speak up if something feels wrong.
Giving patients a voice.
Absolutely. Standardizing how information is passed during handoffs using tools like SBR.
SBAR.
Situation, background, assessment, recommendation. It's a structured way to communicate key info. Pushing for real-time, face-to-face handoffs where possible with time for questions. And clear, simple discharge instructions.
It sounds like nurses and other health professionals are really central to a lot of these solutions.
Oh, completely. Their role is vital. So efforts focus on their work environment too, addressing fatigue through better scheduling, avoiding super long shifts back to back, ensuring enough time off.
Makes sense. Tired people make mistakes.
Exactly. Reducing their clerical workload so they can focus on clinical tasks. Special training for high-risk things like giving meds or handoffs, building that patient safety climate, monitoring performance but with non-punitive feedback focusing on learning, not blaming.
It's encouraging to hear about all these system-level efforts. It really sounds like a lot is being done.
There was a lot of focus on it, yes.
Yeah.
Continuous improvement is the goal.
But for you listening right now, sitting there, what can you do? As a patient, how can you minimize your own risk? What are the proactive things we can all do?
That's maybe the most empowering part of this. Being active in your own care is number one. Ask questions.
Don't be afraid to ask.
Never. If you don't understand a test or why a procedure is happening or what a medication is for, ask. Before surgery, you can help verify, yes, this is the correct site.
Speak up.
Speak up if you have concerns or if something seems off or contradicts what you've been told. Make sure your doctors have your full medical history, allergies, past reactions, everything.
Be thorough.
Yes. If instructions aren't clear, medication instructions, follow-up instructions, ask for clarification until you understand.
Bring someone with you.
That can be really helpful. A trusted family member or friend, especially for important appointments or if you're feeling anxious or overwhelmed, they can be another set of ears.
Good idea. What about medications?
Know what you're taking, keep a list name, dose, how often, share it with all your providers, and before anyone gives you a medication or does a procedure, let them check your ID band, confirm who you are. It's a basic check, but do it every time.
Simple checks, but important.
Very important. It's about partnership.
Those are all really concrete, actionable things. It feels like we can play a role in our own safety.
Absolutely. You are a key member of your healthcare team.
So wrapping this up, what's the main takeaway from this deep dive?
I think it's that medical errors are a really complex and significant issue in healthcare. The consequences can be serious.
Yeah.
The healthcare system is definitely working on multiple fronts, systems, technology, training to make things safer. But being an informed, engaged patient, asking questions, speaking up, that adds a vital layer of safety. It's a shared responsibility.
The partnership for safety makes sense.